All right, when a patient gets here for their appointment, they will check in at the front desk, and then the receptionist will send us a message on Google Hangouts saying that they're here. So then we'll come over here and grab their chart from the bin and check and see what their starting treatment is. And we'll also pull up their case on WebPT. You just hover over their name and then click on this right here. And then that will pull up their case. And then you can pull up their daily note from their last visit and go down and look at their pain scale and their subjunctive from their last time. And that will give you some things to follow up on when you're getting ready to take the note for today's daily note. And then when that's ready, you'll come over here and get some heat packs or ice packs that you need for the starting treatment. And you'll take it over to a table for the patient. And when everything's ready for the setup, you'll go up to the front and you'll go get the patient and you'll call them by their first name and bring them back. Jessica, come on back. And you'll bring the patient back here to their table and set them up. And as you're doing this, you can ask them questions about their pain, how things are feeling since the last time they came in. And you also get the pain scale from 0 to 10. And then you always set a timer as well if they're not using one of the machines. And then you go back to the computer and you write the note for the therapist.
Other important information that you need to know when you're doing this is that, first of all, if there are any changes in the patient's status, you need to inform the physical therapist. That may change the treatment that they're doing at the start. Second, make sure that you're helping each other out as aides because the clinic can be busy, so help each other take off and set up patients. As soon as you pull the chart, make sure to mark the time and initial the starting treatment so that gets done and is accurate. Lastly, this is oftentimes the first impression that patients get as they enter the clinic, so make sure it's a good one. Be friendly, be kind, make sure that the patient is comfortable as they come back.